We have Gina Calderone live from KPFK.
Yay. Thank you for having me.
Oh, it's so wonderful to have you. Such an honor and pleasure. And we're super excited to have you join the conversation and just really being the energy of KPFK.
I'm excited. This has been a long road and an amazing body of work that I've collected, and I'm excited to share it.
Wonderful. Well, I'm excited that you're willing and open to sharing with all of us. And with that being said, I'd like for you to begin, Gina, to share with the listeners, something that may have happened in your life. Typically tends to happen what I like to call the dark night of the soul. That story that led you to the inspiration of becoming a physical therapist, but beyond being a physical therapist, diving into becoming a physical therapist with intention and purpose to really be able to be of greater service to humanity.
After I started working with many people and seeing the body stories that they had inside, many of them were pointing back to different wounds and different traumas, and it really inspired me to go further into their lives and discover the roots and what the emotions were that were sitting inside of them. And I truly was excited and fascinated really with what I was seeing. And from there, I saw that I possibly had my own unresolved trauma and wounds inside my body. And I started to look at my own health history and what I possibly needed to heal myself. And I saw I had chronic pelvic floor dysfunction and a lack of core strength. I just could not connect to the power inside my body. So after having babies, I had postpartum depression, and I just really was not good. I just wasn't feeling right. And so I decided to go into a journey of my own and figure out what was going on in my own body. And as I was working with other patients as well.
Sure. Wow, that's quite the trajectory and, path in terms of what you've been able to delve into to be able to support your clients, right?
Absolutely.
You've been there. And
I've been there. I know what it feels like to feel locked inside of your body. Sometimes that the emotions and get trapped inside, and we live in our head about it, and we cannot express it. And sometimes it comes out through these symptoms, and we have to realize that those are these pain signals, and there's ways of healing them.
Sure.
And a lot of times what I've found, it's through exercise, body work, mobilizations, movement therapy, that these traumas need to move through the body.
Sure.
They get stuck.
They get stuck, right? Absolutely. Movement is so important when it comes to the trauma and how to release that energy, right?
Absolutely.
Now, when you talk about what I'm understanding in terms of like the chronic pain that you dealt with and everything else that you have shared with us, our bodies tend to store, what I'm understanding, those generational trauma in those soft tissues, right? The soft tissues and other organs within our body. Would you like to elaborate further in terms of how does that happen?
How do these emotions get trapped inside of the body?
Sure.
Well, I think when any kind of negative experience happens to someone, these negative emotions get trapped. Anger, guilt, resentment, shame, grief, any of those can get trapped inside of the body. And then the body tries to naturally protect itself. And it puts it into what I call a trauma posture. It's where the ribs slide back, the pelvis tucks, and the head slides forward, and we start to hold tension in our body, creating back pain, any kinds of other pains. And we can look at this energy body map and begin to see where certain emotions are holding in certain parts of the body.
Interesting. Wow, that sounds fascinating. And we're just, 5-10 minutes in. I want to have you here all day so I can just delve into your brain. It's just really amazing.
For sure.
For sure. It will definitely keep going. Now, when it comes to, when you talk about, the way the body tends to, quote unquote, save you, like kind of like a safety net, right? In terms of whatever that may be for you. And you mentioned the posture. Let's talk about the posture in terms of like how to identify, right? When it comes through situations, whether it's the brain, whether it's cancer, whether it's a heart attack, how to be able to identify. And it captured me, and I know that you and I had talked about this, this past weekend around paying special attention to the posture.
Right. The posture is important because when the ribs slide back and the shoulders round forward, we're protecting our heart. So from there, we could be protecting grief, a broken heart. That could be from a parent dying. It could be from a divorce, a breakup, loss of a child. There's so many things that could be associated with that kind of pain. And so if we put our body into that position for long enough, we'll start to feel the physical symptoms. And then if it stays there long enough, our bodies are really smart at getting out of pain. So then we'll shift. So then I noticed that people would shift to another direction. So maybe they'll create a little S curve in their body, and that would look like scoliosis. So now they begin to have this curve. What I've seen is that people will shift away from the pain. So if they come in and they're side bending to the right, I can guess that their pain's on the left because we want to move away from pain. It's just our natural instinct to do, and to sit in it is tormenting sometimes. So we're really good at shifting. And so what I found is that when someone would come in, I would shift them back and forth and flip them this way and that way. And I found myself chasing this wound and trying to get it out of their body. And then they would come to a place where they were like, my father died when I was 3. And so their ankle pain ended up being like after they didn't even have the ankle pain anymore, which was the original pain that they came in for. They ended up having this overwhelming amount of mid-back pain. And as soon as we got to the grief and the loss of their father, which they would just imagine at that young of an age, how could I even carry that much pain? How do I remember that?
Right.
But our body remembers. It holds it.
It holds it. Now, is that coming from your ancestors and, tracing back to like your lineage of ancestry when it comes to that pain?
It definitely could. And I keep seeing that, if that particular person, I could ask them about their parents, and most likely their parent had also had a parent that had died young. And it's like these wounds keep surfacing over and over for us to heal them. And that is the message that I get now after 15 years. We have to heal these wounds in our bodies because each generation, it seems that it's getting heavier and heavier. And the people that I see coming in now are very young, and their bodies are very heavy, lots of anxiety, lots of medication, and they're lost. So they don't know what to do. And the parents are lost too. They don't know either, and they want to help their child. They can see it in their eyes, and the child has no idea what to do. And so I see that it's important for us to tell the secrets that we may be holding, the traumas that we might have not looked at yet, haven't resolved yet, that need to bring some light to our bodies and start opening these doors. And we think that they're not important, but they're vital for our children. We could be holding on to a story as a parent inside of our body that our child, we're looking at them and they could be like mirroring through their hyperactivity, their disconnection, their lack of awareness, whatever it may be, and we are holding the key to that, or their drug addiction. There's a lot of things, and it's within us to empower them and open the door for them, make it easy for them.
Absolutely. Empowering and opening the door. That truly resonates, particularly because of what I'm understanding. You're speaking within the younger generation. You're seeing that more as time progresses.
I am seeing 17-year-olds, 20-year-olds. They're coming in and they are just absolutely deflated. I feel like a lot of them have no reason to live. And I've been talking to them, trying to get them to move, the lack of coordination and connection to their core muscles, which I have found that core muscle is connection to the soul. It's our creativity center, second energy center, where we have our center house of feelings. It's where we feel, and that entire area is shut down. So a lot of them are coming in with back pain. That's one of the first things that I see with younger patients, and we kind of just think that back pain will go away. And as a physical therapist, I saw that if we don't resolve that, it ends up becoming something bigger, something deeper, more systemic. It becomes an autoimmune disorder. Mm-hmm. It becomes cancer. And almost every single patient that I had, I would always ask them if they had musculoskeletal pain before they developed any kind of systemic disease. And almost every single one of them had said yes. So as a physical therapist, I thought, hey, we're the first line of defense.
Sure.
And which connects me to my grandpa. So and my grandfather, and he was a war veteran. And I feel him coming in and saying, you got to keep moving forward with this. You got to keep going. You need to have courage and speak up for these people that have no voice and the traumas that are trapped inside, and stop the over-medicating and get them to move and get them to connect to their families and find love again within their families.
Oh, absolutely. And within that, metaphysical world, and I know you brought some rocks with you, right? Around the energy of your grandfather. So, that tends to happen in terms of, just trusting the process of the energies that never go away and how they want to partake, within this energy realm. And you and I had talked about this off air, how that in my own personal experience, it's a confirmation that you are on the right path. Keep at it. Right?
Yes. When I look at these rocks in front of me, which were delivered from a friend who went to Normandy, and he had seen my post that I had written about my grandfather. He was a 2nd Battalion Army Ranger in D-Day. So he was on the front lines of Omaha Beach, which I read a lot about this year because it was the 75th anniversary. And I had no idea what my grandfather had gone through. And he was taught how to kill, really. He was taught how to become so angry that you had to take lives. And I don't think that that's what a teenager wanted to do so young in his life. He was forced to do it.
Sure.
He earned 2 Purple Hearts. He climbed the wall at Omaha Beach in the early mornings, like, a 100-pound pack on his back, swimming through the waters, having to scale this tall wall. And he made it. He was one of 90 that survived out of 225 Rangers that went in.
Wow.
And when I think about that as my grandfather, I'm truly amazed that that was him. So I learned that he has inspired me to keep fighting this, because when I first started 15, 20 years ago, I would talk about how emotions underlie this physical pain. People just looked at me and they weren't totally into it. And now more people are understanding of it. But my grandfather has shown up in my dreams, and he showed me that the pelvis is the home for a lot of our families. It's where we grow up. It's where neglect and, physical and emotional sexual abuse can lie, and mental illness, everything that goes on in our childhood homes that maybe it was from other traumas up the bloodlines, and it's laying in our pelvis. And we have to clean it out, and we need to reconnect back to our core. And in a dream, actually, it was in a restorative yoga retreat that I went to, and in a meditation, he showed me that the inside of my pelvis was similar to Omaha Beach, that it was a crime scene. It was a massacre. It was like there was so much in there that needed to be cleaned up. And so my grandfather died of esophageal cancer. So that's the throat, right? It's where we express.
Very much in resonance.
And he could not speak, and he could not talk about his traumas. And for obvious reasons, it was nothing that he wanted to talk about. And I feel at this moment, I guess I get to do that.
Absolutely. And the beauty of these experiences within our lineage, in this case, you're sharing about your grandfather, they play as catalyst for us
so
to
much.
Use what they would have wished for, right? And it's never too late. And it passes on from generation to generation. And here you are now. And this is just one platform, but, you've been doing this, being in the energy for over 15 years, and to continue voicing, being the voice of the voiceless.
That's right. And when, cancer runs in my family, so that's what we say. That's usually the way we describe it, is that my father's brothers, my uncles, each one of them have, the older ones have passed away of cancer. So of course they would fall to the fate of their father. And they're basically all in the solar plexus area, which is where our power is taken away.
Right, absolutely. And I'll tell you, when you talk about your grandfather, and obviously at such young age to be dealing with such anger, right? And being taught to kill at such young age, and then as we're speaking,
and then come back and live a life.
And then come back and live a life, and right?
Be married and have 8 children, and then try to become a functional husband and father and provide. And he had a hard time. He had a very hard time doing that. And there was a point of what I heard when he was young and how he acted. And I never understood it then, but I most certainly understand it now, that his actions then were because of trauma. And
absolutely.
I understand it. I have such a bigger heart for it now. So, of course, before coming here today, this weekend, a friend of mine presented these rocks and some sand from Omaha Beach to my father and I, and it was a beautiful moment. I know that's where my grandfather left his little piece of his soul there. So
beautiful, absolutely beautiful. And I'll tell you, as we continue on, in terms of the it really sparks my attention, and the energy keeps coming back. So I just pay attention to that, as we're having this dialogue. The younger generation, and how they're being affected by that, and how they're being impacted by this energy, right? That keeps following through. I mean, me personally, I've been doing for the last couple of years a lot of research for the neurological department at Cedars-Sinai, and it really blew me away. I mean, I get goosebumps as I share with you, which, my body responds often that way, that the children, I mean, I call them children because they're teenagers, they're in their 20s, they're young. And the people that I've been seeing and that I've been seeing for the last couple of years walking through those hallways, with you can tell they just got surgery, brain surgery, young, absolutely young. I mean, it's just, and the numbers are only increasing. So for me, feels to me like that takes on like more responsibility within people as ourselves to really keep having this dialogue in terms of like when you share, clearing out that energy, redirecting you back to your core, right? I'm sure there's listeners out there. I can almost believe this to be true because I feel this. And within the staff too, even prior, going around sharing about the topic for today, where the question is, well, then how can we, right? We're open, but how can we clear the energy? How can we redirect ourselves back to that core of who we truly are and let go of that ancestral lineage? So if there's anything that you can share in terms of obviously what you offer and within your clients that you've been able to see transformation for themselves.
Yeah, I would say that a great place to start is to write down the timeline of your life and different situations and experiences that happened at what age, and possibly draw a line down the middle, and on the other side of it, write your health history. Like, did you have feet pain when you were a kid? And, we don't have to necessarily have a diagnosis. We're just looking for those weak links in the body.
Sure.
And because we don't want it to be diagnosed. I found that a lot of people are waiting for a diagnosis because there's something wrong. There's something wrong. What do I do? So they go from doctor to doctor to doctor looking for a diagnosis where actually I believe what they're feeling is energy. And so one of my first questions that I ask my clients is, if your pain had a voice, what would it say? And so they can begin to free write and just journal about that, of what is that voice of that pain inside? What is the voice of your low back pain or your migraines? What would your migraines say? What are they really actually trying to convey to you? And what do you need to look at? What particular relationships do you need to mend or release? And
Now, what comes through for me as you're sharing, obviously, like ways to be able to release that energy. I know that I personally joined your amazing retreat that was in resonance to this a few months ago. And I remember you sharing with us what they call the root story map.
yes.
And I'd love for you to delve into what does that mean and how can that support us?
The root story map is a great place for you to look at your own diagnoses that you have, if you have any, or symptoms, any pains, whatever you may have, and looking at the energetic centers of the body and seeing where they resonate. From there, you can draw up and look at your lineage and see where there is a line running of similarities of pains and symptoms, which may be your grandmother's. They may not be yours. They may be reverberating all the way down to you. And I've seen this where I had a grandmother who came in who was a sexual assault survivor. Her daughter was facing some pelvic pain, being tested for pelvic cancer. Her mother knew that she had a sexual assault as well, but they really hadn't talked about it. And then granddaughter is having stomach pains. The doctor cannot diagnose it. They don't know exactly what it is, and she's scared. She has this phobia about staying away from the house. So, we look at those symptoms in the granddaughter and think okay, well, she has a tummy ache. Let's give her this. Let's give her that. But really, she's so sensitive, and it's really this young girl's issue is an energetic disorder. And so the three of them need to sit down and have a chat.
Oh, big time
and have
chat.
a powwow.
Well, more than a powwow, because with what you're saying, of what I'm understanding, it's a paradigm. Right? It's a paradigm within the household dynamic, within your family lineage. So for me, when I start noticing repetition, pay attention to the repetition, because that alone is telling you something. So pay attention, right? So obviously with what I'm understanding, it's first the grandmother, then the mother. And so by the end of the day, the question is, who will be courageous enough to cut the umbilical cord, right?
That's right. Who is the healer of the family?
Who will be the healer of the family? And oftentimes, it may well be one or two, who knows, or it may well be us. And to be able,
the healer of the family could look different. They are the ones that maybe are connected to this talk show, and they're listening and they're understanding. They're reading all the self-help books, or all going to great retreats. But the other healer of the family could actually be the addict of the family, and they're really bringing everybody together to really understand the brokenheartedness that's maybe lingering in the family. A lot of times I've seen with people with addiction is that they are the shock absorber of the family. They're really kind of taking in the chaos, or the one trying to be the peacemaker, and suffering in silence and shame, and needing to be able to move that pain through their body. It gets stuck. And where else would we be moving? We tell people to go exercise, tell them to go to the gyms. A lot of times when they're holding so many wounds in their body, they neglect themselves. They neglect self-care. They don't know how to feel inside. All they know is that they don't like how they feel.
Right.
So they're shut down. They're completely shut down. And that's what I usually see. So I treat addiction as an energetic disorder, and we need to change the energy of the body.
Absolutely. Well, I obviously want to continue, and we will be continuing. But meanwhile, right now, for those listening, you're listening to Transforming Consciousness. I am Vanessa Valdez on KPFK.org. And for those listening from your smartphone's Pacifica Radio app, on today's topic, we have been discussing how to heal from generational wounds in the body. Our special guest is Gina Calderone. She is a physical therapist and energetic therapist. She's the founder and owner of Century Portal 4 Studio. For 15 years, she's been a chronic pain expert, treated hundreds of individuals and families to heal pain and generational disease. So continue to stay tuned. And for those that would like to call, the number is 818-985-5735. Once again, 818-985-5735. All right. Well, are you ready to continue with this amazing segment?
Let's do it. Yes.
Well, I know that you have here, when I joined the retreat, in terms of like little bullet points that I think can really resonate with people and serve their process. I know, let's see, you have 1, 2, 3, 4, 5, 6. Not sure that we'll be able to get to all 6 of them, but let's see here. Why don't we go for, it says on here, heal the broken-hearted wounds, driving generational addiction, pain, and disease. Now, when you mentioned addiction, it really resonated with me how you brought that to the forefront because, yes, oftentimes it may well be the one in the family with either the addiction or fill in the blanks within those dark shadows. Those that have resided in their shadows also playing as catalysts, right? So not so much only the peacemakers, but also what they call, quote unquote, the black sheep, right?
That's right.
Yeah.
And, you know, these people that are holding in, what I've seen is sexual assault or molestation. These wounds are so deep down inside themselves, and they are scared of them. And the wound hides from them as much as they hide from the wound. And sometimes, a lot of time, what I've seen is it's, the perpetrator. I'm going in, I'm looking at the crime scene. I'm the body detective. I'm going in and figuring out what's happening. And sometimes this person that hurt this child could be someone that they know, and even in their own family. And it shatters a family. It's hard to bring up. They have a hard time bringing it up. And, you know, I have said today, I've never met a person who is an addict that didn't have the biggest heart in the world. And they have such a heart to where they actually don't even want to bring up the trauma because they know it's going to expose so much of the other person that hurt them. It's like they feel for the person that actually hurt them. And I don't think it's about seeking, it's really about rehabilitation. This isn't about getting people in trouble and putting them behind bars as much as it is. We all need to rehab our bodies and so we can thrive. And I think when I think of of addiction, I think of the mother wound, where our mother is really the person that's there to protect us. And if it's in the family and the mother hasn't, you know, this child can take on this secret anger, resentment. Then they start to have behavioral issues. They can't pay attention in school, and they start getting in trouble, start hanging around different friends. They start numbing themselves. And then mom doesn't know what to do. She's trying. And then it just keeps snowballing until it's out of everybody's control. And then we don't know what to do.
Right.
And
that's obviously within the divine feminine, that energy when you speak of the womb. And we go back now into the masculine energy, like when you talk about your grandfather, right? And going through so much trauma and then feeling the need, right? It's almost like you're programmed to tell yourself, now that I'm here, now it's like taking on a family and taking on children, right? But it's like, were you even ready? You haven't even healed yet.
No.
Right?
And if you think about it, where was he going to heal? Because if he went to the doctor, what would his symptoms be? And then, you know, I mean, if you go to a physical therapist, it's back pain. If I went to the doctor, maybe it's, maybe I had chronic migraines, whatever it would be. But each would be treated most typically with medication.
Sure.
And it's not really and if I, you know, had, I would think he had post-traumatic stress. And so we would talk to a therapist. which he could understand. We know where the trauma came from.
Right.
We know that it was, June 6, 1944. That's when the pain was.
There we go.
And it's like, okay, now what do I do about it?
Well, speaking of what do we do about it, obviously, as you know, we live in a society where, we go within the medical field and they will tell you the symptom,
That's
right? And through that symptom, it's not like they even know any clarity, but they will overprescribe, right?
That's right.
And then from there, it's like what happens to the cause? So again, you and I were speaking about this off air around it's when that particular patient has gone through so many doctors and they still are seeking support. They're still seeking to be healed. And those are the clients that you've been receiving. Those are the clients that I've been receiving. They're like, we need answers.
And they're coming. That's who came through the door. That's who built my practice, were these people that, I started this business 15 years ago, and the people that kept coming in had been everywhere and tried everything. They had tried physical therapy. That's where I was like, what am I doing any different? And I realized that I needed to study these stories that people were telling me when I was, when I go into my treatment method and I'm doing mobilizations or I'm opening up the body and trying to reverse that trauma posture. I would see I would see them open their throat. I would hear the voice quiver, and I'd hear them tell stories that they had never told. I knew that they had never told. I'd ask them, and they said, no, I never knew. I think it brings, as we release these memories that are trapped inside of the fascia, then it, triggers the consciousness, and then they're like, oh, now I remember.
Right.
Because before it was blocked, but it's still holding in the muscle tissue. And as we're physical therapists, we treat muscle tissue. That's what we do. And so we have to hold the space. So from there, I just continued to hold space for people, and their stories over the years got bigger and bigger, deeper, more intense.
Well, speaking of their stories and, you've been able to witness, right, in terms of like their own transformation, what's coming through for me, obviously, as a physical therapist that has really created such unique paradigm in terms of how you are within your field. I really acknowledge you for that. We definitely need more physical therapists delving into this much more holistic way of being to be able to be of better support for their patients. I myself have been, I think I had shared with you within personal family situation, dealing a lot with physical therapists and, just out of observation that there's so much potential, but it's like you're limited, right? You're limited in terms of the paradigm and within that field of how you are taught to be, that you're limited and you're limiting yourself because there's so much more that you can offer, but it's not yet.
And that is why I left a traditional clinic and started my own practice. And it was interesting because people's perception would be, well, why would I come to pay cash and see you as a physical therapist when I have insurance? And it was really cloudy to me at first. I was like, well, and I didn't know how to answer that at first. And so I studied.
You will be healed.
I'm like, because we're going to get to the root.
Exactly.
And someone had inspired me and told me, be the best physical therapist you can be. And the money will come, the clients will come, it will all take on, you will build this business. And it has been that. And I am grateful and thankful that I hung in there. But at first it was funny. I started off as a Pilates instructor, and that's how I built my clientele, because everyone loved Pilates and everyone wanted a strong core. But what I realized is that they didn't know how to connect to the deeper layers of the muscle tissue. So I had to do some body work through the back and open up the spine, reverse, open the chest, open the heart, open the throat. And these stories came in to where I was like, wait, we're not even doing Pilates anymore.
Now this is like a spiritual healing session right
It took
here.
on a life of its own.
Right.
And from there I learned gyrotonic, and I learned how to move in a three-dimensional system that actually made sure we opened up every single crevice in the body. And as I open up the body and help them release these stories, then we can connect them back to their core and rebuild them. And that's where the light comes in, and that's where the passion comes back in, and they get to thrive and have a purpose in life.
Because you are delving into the root cause, right?
That's right.
Speaking of the cause, it's deeply rooted in there. But how is it really going to be able to heal itself if you're not somehow trying to, be in that energy and pay special attention to it?
And that's one of the other bullet points on that card that you have is underneath our wounds lies our greatest gifts. And to go in there.
We're synchronized. That was my next question to you.
There
but
we go.
You're already getting there, so that's great. But yes, it's as you mentioned, in your wounds are your greatest gifts, your life's purpose and passion. So now let's delve into that.
And that is it. It's having the courage to open the door. I give the analogy a lot to my clients that, they're standing up against the door's shut, and I need them to lift up their hand. I need them to put the hand on the handle and open up the door. And we know exactly what those feelings inside, they're nervous, they're anxious, they don't know what's in there, and they're unsure. But you got to do it. And if we don't, we stand outside the door and we just get more diagnoses, more pain, more suffering. And I'm like, open up the door. And the minute you walk in there, it'll be dark for a second and the light will turn on. You'll probably most likely have some help of some ancestors and your guides. And
it might get dark again.
Yeah.
And that's okay.
And that's okay.
Yeah.
That's
because
okay.
sometimes the darkness is not just 1 minute. It may well be.
Right.
But oftentimes if we can reside
in ebb and flow,
the energy of resilience, and just allow yourself to detach and surrender to the process, even if that entails being in the darkness for longer than a minute. And not making your feelings define who you are.
That's exactly
because you're just a spiritual being having a human experience. And it's the human who's having those emotional experiences. Right?
That's right. And I think that one time, that first time, and it is everything. And then the next time you do it, like you said, it's an ebb and flow. You're going to go in and out. You're going to find the darkness again. There's the light, and bouncing up and down, and it becomes the journey. But it's never like that first time. Mm-hmm. And I encourage people to open the door, and you will find your greatest gifts that will become a passion. It's coming from a different place. Your heart is so involved. You will not want to get off that path. You will find who you are meant to be, and how to inspire, if you decide to have children, how to inspire them too and get them on their path too.
Right.
I've seen a lot of broken dreams due to pain. And it's like if we could get under those wounds, or if their parents could get under those wounds, it lifts them and helps them find their purpose.
Helps them find their purpose. And for those listeners out there that may be, asking themselves, Gina, why is this so important? Why is it so important that we become woke, what I like to call woke, into this energy of realizing that we may be holding on to energy and emotions and feelings that are not ours to carry, and that it is time right now to release? What will that do to humanity from the moment that we actually, as you mentioned, allow ourselves to open the door, right? Because we need to do that for ourselves, not the physical therapist, not the life coach. It's like we're guiding the process, offering what we can, our gifts, but you are to open the door for yourself. Why is that so important?
It's important for the future. It's important for our children. It is important for yourself in that we can live happier lives, that we can feel more joy in our lives and not be so distracted and busy, disconnected, and it makes us suffer inside and we get lost. And I think that when we are more connected and we feel elated and powerful and purposeful, it can raise humanity, and we'll be more kind to each other. We'll think of others. We can, when you get to a place where you feel empowered, all you want to do is help your community, and you want to help others grow and feel happy too.
Feel happy too. Well, for those listeners out there, you're listening to Transforming Consciousness. I am Vanessa Valdez. on 90.7 KPFK and KPFK.org. And for those listening from your smartphone, Pacifica Radio app, on today's topic, we have been discussing how to heal from generational wounds in the body. Our special guest is Gina Calderone. She is a physical therapist and energetic therapist as well. She's the founder and owner of Centripetal Force Studio for 15 years. She's been a chronic pain expert, treated hundreds of individuals and families to heal pain and generational disease. So continue to stay tuned. And for those interested in calling and asking Gina a question, the number is 818-985-5735. Once again, 818-985-5735. All right, Gina, are you ready to continue?
Let's do it.
All right.
Stay on the path.
Let's stay on the path. Now, in terms of your studio, what is it that you offer? You know, now that we're speaking about, you know, really diving into the root cause of what you can see from the symptoms, the surface aspect of it, right? Tell us what you share and what is it that you offer in your studio for those that may be interested.
I always want to meet with somebody initially, so I have an initial evaluation that I do, and I have them, you know, I write out the health history, and we really get to understand and put all of the, if there's traumas and what kind of experiences that they have endured in their life. And I also look at their health history and seeing where they have the pain, what kind of symptoms have come up, what kind of diagnoses that they have, and what kinds of experiences that they've really endured in their life. And I put it all together. And in the last year or so, it's become pretty complicated and intense. And I have found that I have run out of time and I could use a lot more time with my clients. So I've recently developed an intensive program where instead of working with somebody for 90 minutes, or an initial 2 hours, I'm working with anyone from 4 to 6 hours in one day. And we begin the initial evaluation, and then we go into treatment from there. And it's been really effective. What I've seen is that it helps people breathe again. That has been what I've heard from the people that I've worked with. It's almost like a resuscitation, and it opens up life. When someone is suffering, a lot of times that root center is closed and they're really open up top. So that's where we feel this need that they don't want to be here anymore, this loss of life. And when they're coming in, they are so depleted. They are so at the end of their rope that I need that time to open up the body, release any of the traumas as quick as possible through the tissues, and help them breathe again. And it's really resetting the bodies and resetting the senses. So I work with the eyes, I work with the vestibular system, I work with the throat, tactile, I work with all the different senses to make sure that we shut off that fight or flight response and reconnect them back to their power.
Reconnecting them back to their power. Now, it seems that the listeners are requesting of me to mention the information again so they can perhaps reach out and ask you a question. So again, you're listening to Transforming Consciousness. I am Vanessa Valdez on 90.7 KPFK and KPFK.org. And for those listening from your smartphone's Pacifica Radio app, on today's topic, we have been discussing how to heal from generational wounds in the body. Our special guest is Gina Calderone. She is a physical therapist and energetic therapist. She's the founder and owner of Centripetal Force Studio. For 15 years, she's been a chronic pain expert, treated hundreds of individuals and families to heal pain and generational disease. So continue to stay tuned. And once again, the number to call and ask Gina a question is 818-985-5735. Once again, 818-985-5735. And lastly, this is the last time I will be repeating the number. Please make your calls. The number is 818-985-5735. All right. Well, I've been seeing here the little lights going on and off. Perhaps people hanging up or not hanging up. Who knows? But we continue on, right?
You know, that happens in my studio. I get people that will call, and then I call them back, and then I call them back again. And, you know, that's what happens, though. It doesn't surprise me that people would be little scared and to ask these questions because you're opening that door.
Right.
And I know my job is to create a safe space for people to share their stories and to release whatever is needed from their body.
Whatever is needed from their body, absolutely. And I will tell you, in terms of when you mentioned breathing,
through the nose, it sends a signal down into the body to relax. So that's usually where I start, because when we encounter something traumatic, our eyes can immediately start darting.
Our eyes start darting. And with that being said, it looks like we have already callers, right? Let's see here what Ricky has for us. Okay, so he's still in the process of colors are coming in. See how the energy just starts to pop in and out. But I will tell you that it is really important to breathe. And I personally was, being with a client recently where I noticed that when we meet, he does not breathe. And I brought that to his attention. I'm like, do you realize that you're not breathing and you have not been breathing for an hour and a half? And he just looks at me like, no, I would be dead. Oh, then let's delve in a little deeper in terms of what that really represents. So I just,
and
really
connecting the breath to the core.
Connecting the breath to the core, absolutely. So I really appreciate you, delving into that and shedding some light into that. Are you ready, Ricky? Not yet? All right. Well, as he takes... Okay, so we have one, right? We have Lisa from Los Angeles. Lisa, what's your question for Gina?
Hi there. Can you hear me?
We can hear you.
Great. Thank you so much. My mother had an accident and I was in the womb. She flipped a car down a mountain and I was given a brain surgery at birth at 5 weeks. And then I have congenital scoliosis and a butterfly trauma from it in the neck. I have terrible problems breathing, and all the neurologists at Cedars in years can't find the correlation. And I was wondering if you had anything you could speak to, something that might be viable as well as emotional or traumatic.
Absolutely. I think a birth story is really important, and what happens in utero most certainly is still part of your body. And what I feel when I'm working with somebody is that my intention is for when I think of your body and that I would want to start to straighten out the scoliosis, help you find your core, help you breathe again, that from there, that's where you can heal those wounds inside of you, that, the impact that you endured when she was pregnant with you, right? And that we feel that.
Beautiful. Thank you so much, Gina. We will have to go to the next person because we have quite the list now. We have Bernice from Downey. Bernice, what's your question for Gina?
Yes, hi, Gina, and thank you for letting me have this question.
Hi.
Hello?
Yes, we're here. What's your question?
Yes, I want to know, I've been having some issues since I was, before I was born, and I've been having so many surgeries, and I don't have intestine, and I want to know if it has something related with the abuse and also the rejection, and how can I be able to connect with my core, like you were saying?
Yeah, I would have questions. I'd want to interview you about your mother and your family, and seeing what your mother has gone through in her own health history, and grandmother possibly, and why it's deposited into your body, and make those connections.
Beautiful, making those connections. Well, wonderful. Thank you for your question, Bernice. Now we're going to the next person. We have Rosa. We don't have a location, but Rosa, what's your question?
My question is that I was abused at 7 or 8 years old. No recalls of what happened, but I know that I was sexually abused. And that my dad is an alcoholic, so I went to a lot of trauma during those times. But my problem now, I have lower back problem and left shoulder problem. I would like to know what advice can she give me.
I think that EMDR is a great method for you to try to recall any of the traumas that are coming up. You definitely need a body worker that can help work on your back and help you release those traumas. When I think of the shoulder, I think of the heart line, and that your father is your protector, and just we would want to rule out if there's any connection with those two traumas.
Beautiful. Well, thank you so much to all the listeners for calling in. Unfortunately, we're not going to be able to get to everyone. I mean, we have a list here of people that called, last minute, and we really appreciate you. However, I would like to share that potentially Gina may will be here again next week. So for those that have questions, we're going to definitely be delving in on much more deeper and also offering some package deals that can support your process. Now, as we're coming into completion, those that may be interested in learning more about you, where can they find you, Gina?
You can find me on Facebook under Centripetal Force Studio. It's CENTRIPETAL. And I'm on Instagram at the letter C, FORCE Studio.
Beautiful. Well, Gina, it's been such honor and pleasure to have you join the conversation
Thank you.
today.
Thank you so much for having me.